Today we're going to be talking about cervical myelopathy. So again, we'll start with the presentation and then we'll go to the physical exam and the treatment of cervical myelopathy. So thinking through systematically in terms of the typical presentation of cervical myelopathy for a patient. So in terms of location of symptoms for this, what's interesting is, yes, the patient absolutely can have neck pain, but they could also have upper limb and even lower limb discomfort or symptoms. And part of the reason for that is because with cervical myelopathy, we're actually having injury, inflammation, irritation of the spinal cord itself. And as we know, the nerve roots that are traveling through that region go on to provide strength and sensation to the upper limbs as well as the lower limbs. But in my experience, I would say that typically when patients are coming in, of course they're going to report some pain, but what's going to be more distressing to them is the loss of function and other symptoms that we'll talk about here in a second when we get to associated symptoms. So moving through our systematic approach in terms of the quality of the symptoms, quality of the pain, definitely tend to see a little bit more, of that neuropathic quality with this etiology. So the electrical shooting pain is a common description from the patient. And then in terms of the radiation of the symptoms, like I said, upper limb involvement, but you can even get symptoms into the lower limbs as well. In terms of the timing of this again goes back to kind of a couple different presentations, which is common in the musculoskeletal world. It could either be a relatively gradual onset in more of a degenerative spine, and there may be one event that kind of pushes it over the edge, or trauma can definitely lead obviously to the presentation of cervical myelopathy. Typically those cases are going to be presenting more to the hospital, so I would say in the clinical setting there may be somewhat of a gradual onset of symptoms with potentially an acute worsening after a ground level fall or a motor vehicle accident that pushed things over the edge. In terms of things that make it better and make it worse, once it gets to the point of myelopathy, typically those symptoms are going to be fairly constant. Of course, any neck movement or use of the limbs may exacerbate symptoms, but once it gets to the point of cervical myelopathy, those symptoms are going to be present on some level, usually for the patient, regardless of position. Now, once we get to associated symptoms for cervical myelopathy, this is where we really need to do our due diligence and make sure that we're checking all of our bases for the patient. So some of the common and red flag signs and symptoms that would make you start to think about cervical myelopathy would be things including bladder and bowel changes. So this is an upper motor neuron lesion, which we'll talk about more and more as we go through this series. But with an upper motor neuron lesion, we are going to have changes in the bladder. So, for example, with the bladder, in contrast to cauda equina in the lumbosacral region, where we're going to have a flaccid bladder and bowel potentially, and a complete loss of control of bladder or bowel. When we have a cervical myelopathy picture, we're actually going to get somewhat of an increased tone and a spastic bladder. So the patient may report incontinence, but they also may report increased frequency of urination and not being able to empty all the way due to the changes in the bladder itself. So not to get too much into the weeds with that, but bottom line is there potentially will be changes in the bladder and bowel that changes in the frequency, changes in the ability to control the bladder and bowel movements. Now, other concerning associated symptoms would include loss of balance is a big thing you want to look for, and especially because having a fall is such a potentially critical event in these patients. They could go from having a cervical myelopathy to now having a significant spinal cord injury, because obviously in the setting of cervical myelopathy there's going to be some significant stenosis, and with the loss of balance those patients are going to be at increased risk of fall, and if they subsequently have a fall, like I said, we could be looking at an even more significant injury to the spinal cord at that point. So loss of balance is another significant associated symptom. And aside from that, the patient may report some muscle spasms and increased tone. And and also just general loss of coordination or control of the upper and lower limbs themselves. So we'll look at some of those upper motor neuron signs when we get to the physical exam, but that's the general common clinical presentation for a patient with cervical myelopathy.